Welcome to the show. I'm Craig Anderson. It is Call the Mayor Wichita, 316-491-5787. That is your number to call in here to the show. We've got kind of an extended version today. We are not sitting next to each other like normal. We are keeping our social distances here. So Mayor Byrne and Whipple, appreciate you being here. As always, it is Call the Mayor Wichita. Adrienne Byrne with the Sedgwick County Health Department. Thank you for joining us. You are the director there, so we'll look to you for some answers. You can call with any questions that you have. The number is 316-491-5787. First of all, Mayor, I will start with you. We do have a bit of a crisis on our hands. We welcome any questions here, but we do have the COVID-19 that has been in Sedgwick County. It continues to crop up in other counties as well. City response so far, how do you feel we're doing?
So really the city response is really backing up the county, to be quite honest. The way our local government system works is the county commission actually serve as the Board of Health as well. So what we're doing is trying to work with them to implement what the best strategy is to combat this. So we had to wait for the county commission to come out and do a stay-home order. That wasn't something that the city does on their own, which makes it different than other cities. You know, everyone is kind of looking at Kansas, and seeing that model and wondering why our city isn't doing the same thing. Well, it comes down from the county. And then as partners, my job is to help echo that message that they are putting out, as well as loaning our county partners Century 2, loaning them other resources we have on a city level so that we can get the most out of our assets to protect our population.
It's interesting to see you talking about Century 2. I know that they're taking county ambulances, city, into the basement where it's contained, and they're disinfecting the ambulances, and about a half hour they can get them out into service again. Adrienne, our county health director, your thoughts on staying safe at this time?
It is very important to maintain the social distancing of 6 feet, and really important to just practice the good hygiene of washing hands. Good 20 seconds. 20 seconds seems like a long time when you're washing your hands. And it's just crucial that people keep their hands away from their face because that is one of the main ways of spreading COVID-19, by touching an infected surface and then putting our fingers in our eyes, nose, or mouth.
And again, I know it bears repeating, so I will repeat it. For my 16-year-old or for your 16-year-old, anybody under the age of 30, you're not Superman, you're not invincible, and you can spread this to somebody else. So washing your hands. Okay, so COVID-19 goes through droplets primarily. Adrienne, help me out here if we need you to jump in, but spread through droplets. Somebody sneezes or somebody gets something on you or on the counter, you pick it up, you introduce it through your eyes, your nose, or your mouth, so keep your hands off your face. That is very important. Now, Mayor, another thought too here. I know that the city and county have held these kind of joint press conferences now, as we saw outside. Beginning on Monday, we had them outside. How important is that right now for everybody to kind of make sure that we're staying safe?
This thing is, looking for the camera. This thing is, it's real. It's not a, it's nothing we should be touring around about. It's definitely coming, and for what we have to do is model best practices and take best practices, which means utilizing social distancing. We're doing that in our office. We are making sure that City Hall is a skeleton crew right now. We want to, the people who are working are utilizing social distancing as well. And moving forward at our press conference, we did that because no one really wants to catch this. And another thing I want to kind of add to that is, although someone like me, I'm 37, I'm not in that the range of people who this has primarily targeted, who have actually died from this. But if you're a younger person who thinks, hey, I can fight this off, it's really not so much about you, because what we're worried about is younger people who might not follow social distancing because they think, hey, I'm not going to die from this. First of all, and I'm sure the doctor can confirm this, it is going to be pretty awful to have to, if you catch this, to fight through it, even if you're younger. And it's not really about you, it's about grandma. It's about visiting mom. It's about touching areas out in the public, and then having someone else who might be part of that vulnerable population catch it from you without you knowing that you have it. So not only are we practicing this, but also we want to get that message out, because I think that there are some people who don't realize how important it is that we get ahead of this spreading by practicing social distancing.
Okay, 316-491-5787. Go ahead and call in. We will talk about anything. So you can ask questions about golf or the city or Century 2's future or that's fine. We do have one call, 316-491-5787, but we have Oletha. Oletha, you are on the line. I'm Craig Andrus. What is your question?
Yes, hi. Thank you, Mayor.
I think I know this voice.
Yes.
Well, I am wondering what plans does the city and county have in place for the homeless population here in Sedgwick County?
Very good question. So that actually, though she didn't confirm it, that sounded like Senator Aletha Fauskido.
That was Senator Aletha Fauskido, yes.
You know, is always, her heart is always in the right place, looking out for all the people of Wichita. And, you know, when it comes to what are we doing about the homeless, there actually has been some discussion and a little bit of confusion on what the plan is moving forward. As the city, we have offered up the old library to the county because the county is really taking the lead on this. And I believe actually they are utilizing our nonprofit sector to help as well. And so our role is, okay, how do we provide these resources? One of the problems with this is if we were to utilize something like the old library well, first of all, and I didn't know this until it was reported back, the old library is actually not, some of the utilities aren't there anymore. It's really not in a great condition to host anything, but also bringing people in a large group like that into one area with this virus and how contagious it is isn't proper. It could actually cause more problems, and we would be exposing people, you know, to this virus. So we're in a very interesting dilemma that, you know, I believe that is being worked out over on the county side, and I'm just pretty much getting briefings on it, but where we get to try to help a large population while still keeping them healthy by having applying social distancing and being able to take care of some of the other concerns with our homeless population, such as you know, if there's any mental health issues, if there's any issues with substance abuse, how do we address that? So it's a lot more than just kind of opening up a facility and letting people in. It's also keeping people healthy and you know, solving any of the problems that you know, might occur with 400, 500 people in one location.
And I can let you know that what we are doing, we currently already work with hotels to put people up when they are when they have TB and need to be isolated or quarantined, and we've done the same thing with a couple homeless so far that have come into our community from another state where they needed to be quarantined. So we have them up in a hotel and are helping with food, and then we have another partner or two that help with that as well.
Adrienne, as the health director, I wanted to go ahead and show this website for COVID-19 information and SAHO details. We've got a full list of what's considered essential businesses. We have essential businesses still functioning here in Sedgwick County. But having said that, you can go to sedgwickcounty.org/COVID-19. Right now, as we stand, I know that people will look at this on YouTube later and this will air, you know, some folks will watch it later, some people will see it on Facebook and social, but where do we stand with numbers right now? And let's talk a little bit about the curve, the transmission here.
So we have 16 cases right now, and just a week ago we had one. And when we look at the state of Kansas, 2 weeks ago we had one in Kansas, and now we have 172. So in Sedgwick County we had one, now we have 16. We are now as far as the Sedgwick County, the United States, we have more cases than any other country at this point. So we are just exploding. 4 weeks ago we had 14. Tonight we have 82,404 cases with about 1,200 deaths. And so we are surpassing others. And so it is a real threat and a real problem.
Now, do we see guidance coming to us from the federal government at this time, and how involved are they with the process? I know that you keep track with Kansas and our Department of Health here.
We do. We are in regular contact with KDHE on a regular basis, and then during COVID-19 and other outbreaks then we are constantly on the phone with them, and as well as Center for Disease Control and Prevention. They are learning as well as everyone else around the country that is dealing with this, because it is such an evolving situation, and things can change. They change so rapidly that during the day we'll get updates. We'll be ready to put information out to the physicians, and we got to stop because now there's new guidance. And so it's just it's a moving target, but we do receive guidance from the Center for Disease Control as well as KDHE.
That's encouraging to know that we have our leaders with the city and county and our county health department working on this. 316-491-5787, that's the number. We do have a caller now. I got in touch with Roger Marshall, who contacted me as well. Roger Marshall, Congressman from Great Bend. You are working on the federal level right now. Welcome to the show.
Hey, Craig, how's it going? Good evening, everybody in Kansas from Washington, D.C. It's eerily quiet today. Hardly a person at the airport. Just landed 30 minutes ago.
Now, I do know that you were taking your precautions, and you said that you literally had a bag of wipes that you had made yourself. Is this a scary time for travel, or a kind of fairly normal time for travel? I don't want to put words in your mouth, but what are your thoughts there, Congressman?
Yeah, my daughter, unfortunately, I couldn't find any more wipes, so my daughter taught me how to take toilet paper and add some isopropyl alcohol and make my own. But I would say it's just very quiet. I think there was probably 10 or 12 people on the jet. 4 of us were Congress members. Coincidentally, all of us tried to get back here for votes. It's very quiet. I just try to practice extra social distance. The president's asked for 6 foot. I'm trying to make 10 foot. The airlines did a great job coordinating that, making sure we're all staggered, kind of like a checkerboard seating, all those types of things. So we're taking as many precautions as we can. But I think it's important that Kansas has a person voting here for us. This is the biggest financial package we've ever done. This is I don't know, I have to go back to D-Day for a moment in history like this, the consequences to the United States of America.
Congressman, I do want to ask too at this point, we are looking at a bill that, you have publicly said already, look, there's some imperfections here. We're going to get the Senate to do this. Now the House comes. So is this going to happen tomorrow? And what are some of the challenges here, or some thoughts on this aid package, and what's it going to do for kind of people like me, the little guy?
Right. Well, since Sunday, Speaker Pelosi has held all of America hostage, and since then, hundreds of Americans have died. Hundreds of thousands, maybe millions of Americans have lost their jobs. So she's kept us hostage.
Congressman.
Congressman, I will allow this interruption.
No, if you're going to crash my show, you're not going to make it a political infomercial. All right, I was in your office 2 weeks ago, and you didn't bring this up. All right,
who am I?
Okay,
who am I talking to now? Who's interrupting me?
This is
this?
The mayor of Wichita,
Mayor
Brandon
Whipple, Wichita.
You're on and call the mayor show.
So your thoughts there?
Yeah, I don't know. I wasn't expecting getting blindsided like that. But look, Speaker Pelosi has held us hostage, and hopefully she won't hold it up any more tomorrow than she has so far. So we're hoping that she'll let us vote on it, and we can do everything we can to protect Americans, to protect Kansans' lives as best we can. So that's the hope tomorrow. The purpose of this bill will mean, number 1, protect the health care of Kansans. Number 2, protect families. And number 3 is to protect our jobs and protect our economy.
Well, okay. Well, thank you for that. I appreciate it. And the number is 316-491-5787. And that was certainly not the intent of having him call in.
Listen, if he says number 1 is about the American people, that should be his number 1 thing he talks about. I am very tired of people who are saying this should be partisan. All right, this is about Kansas. We just heard from a doctor that in over a week we had 1 case. How many do we have now?
16.
16, and we are on the show right now to put Kansans first. And we got someone who's calling in and wants to talk about Washington politics. No, I'm sorry for that outburst. I'm sorry for the people who think that they want to hear that from the congressman. That's fine. right now I want to hear from people in Wichita who want to know how we're going to actually solve this problem and not have a political infomercial instead.
Okay. Well, didn't expect a political
Well, I mean,
back and forth tonight, but I understand.
if number one is the people, let's talk about the people. We can do partisan politics when it's campaign time.
And you had asked about flattening the curve.
Yes.
And that is what we're attempting to do with putting the stay-at-home order in. And Sedgwick County acted quickly in front of a lot of other counties and states in the U.S. But there's really no, it is a very difficult time, so there's no really right or wrong. We're kind of feeling as we go. But the whole thing about flattening the curve is with the stay at home is instead of what we saw in China and Italy, where there was this and it flooded our hospitals and emergency rooms, but the hospitals couldn't keep up with what was occurring, with really trusting the people in Sedgwick County to adhere to this and stay at home and take it seriously, that we're hoping instead of this and overrunning our hospitals and not being able to take care of the people who need to be taken care of, that we slow it down a little bit. Now it's going to last a little bit longer in that way, but it allows our hospitals to catch up, and right now we don't have to catch up because they're not flooded. We don't have our ICU beds flooded with people with COVID-19, so it allows them to treat the people that need to be treated.
And I guess that's a good jumping off point here for our next caller. You can call the show, any question you want, 316-491-5787. Stephanie, welcome to Call the Mayor Wichita. What are your thoughts?
My thoughts are, of the three hospitals here in Wichita, Sedgwick County, the three major ones, are they going to have to compete for the needed supplies that they will need if this disease escalates? As I have heard in other states, they are competing with the federal government for their needs. When they call and try to get supplies, the federal government is also calling and trying to get the supplies. So are the three hospitals going to work together, coordinate, or is somebody going to coordinate for here in Sedgwick County?
Stephanie,
That's a really good question. I was actually on the phone about 2 days ago with the president or the leaders of Ascension Via Christi and also Wesley, and what they're doing right now is they are preparing for an influx of patients. They are actually utilizing different. I think they created 84 extra beds, and they are competing for supplies. But one of the great things about Wichita is that our community is coming together and even donating some of these supplies. So we do need what's referred to as PPE, which I didn't know before this, but doctor lingo, is personal protective equipment. And so we need masks, we need gloves, and they are people in our community who have been donating those. Now, when we talk about flattening the curve, that's really what we're trying to do here, as the doctor just articulated, where by flattening the curve, it's not that we want no one to catch this, of course, but it's to slow down how many people catch it at once. Where if you do catch this and you do need hospital attention, that there will actually be a bed for you, that there will actually be the resources you need to get treatment, and that is prolonging this and allowing the hospitals to be able to replenish their supplies as we go. That's really the goal here. And our hospitals are forward thinking. When I was on a conference call, they asked for the county to put in this type of these type of measures that the county has, and they are converting anesthesia machines, I believe, into respirators. They are doing some creative stuff to also prepare for what's Plan B if they run out of that stuff kind of in that first tier.
Well, and you bring up a good point. There are several different companies here in Kansas that have started to kind of ramp up to see what they can do for hand sanitizer, helping out with the N95 mask, even the face shields and the gloves that Wichita Police Chief Gordon Ramsay has mentioned. Look, we know we don't have enough of that personal protective gear, the PPEs. We don't have it. We're looking for it. The chief told me that he's been looking for that for, I want to say, a little more than 3 weeks right now, so it is out there. So obviously, if you know somebody that has the ability to make that stuff, go ahead, get a hold of the city, get a hold of the county, either one. Adrienne, maybe a good jumping off point here, as we mentioned the phone number, 316-491-5787. Call the show. We'd be happy to take your questions. Is there a concern with hospitals and hospital workers? I know that everybody's still having babies. We have everybody that's still going to need cancer treatment, some of those types of things, but those things continue right now. So wherein lies the balance?
They do, and we still, we're at the end of the flu season, but we still have flu going on in our community as well, although it's getting pretty minimal. At this time, the hospitals are in a good place to be able to handle patients as they come for COVID-19. And we started meeting with our partners a little bit over 3 weeks ago. All of our health and medical partners, we called them together in the Emergency Operations Center and began talking about what we needed to do to coordinate and how to plan for this. And the whole issue of personal protective equipment came up at that time, because it is an issue that we all are struggling with, but we are in good communication. We have a city liaison that we're working with, and as those supplies come in, just dispersing those here and there, but slowly and surely they're coming in.
We do have another caller, 316-491-5787. Call the Mayor of Wichita. Patrick, you are on the show. You have a question. Welcome, Patrick.
Welcome, Patrick.
Hi, good evening. My question is, we watch the daily briefings from the president, or if we go to the governor's website or some of the Kansas websites that give us updates, sometimes there's gaps, and I understand because everything is so evolving. But my question is, with the help that we're getting from the federal government and with some of these daily briefings that say help is on the way with the PPE and the equipment, where is Kansas in all of this? And is there a way that we can find out what is being provided for us? We hear one thing, but we don't. But then, we turn around and we hear that, other states are not getting what they were told they were getting. And when I follow some of the local websites, that kind of seems to be the indication too. So I really want to know if our healthcare providers are going to be ready when things escalate. And then that kind of segues into, as more things close in the city, and then people's only outings are going to be to these grocery stores and to get the things that they need. Are the people that are there every day working tirelessly to stock these shelves, these young people and older people, are they going to be protected? Because the stores are getting a little bit, tense.
So, and I'll forego the medical part of that question, but really there's no blueprint for this. In our modern history, we have not seen anything like this coming our way. It's really comparable to a natural disaster more than anything else. So people are, I think particularly at the stores you mentioned, people are tense. People are scared, and it's okay to be scared. Like I said, this is very unprecedented, and I think people are going out and they are probably overbuying certain products, and which there's no shortage in a supply chain for groceries, for toilet paper, for these other things, but they're getting bought off the shelves, and that's creating really some of these problems at the supermarkets. Now, the supermarkets, from my understanding, the ones that are following the best practices are actually encouraging being 10 feet apart, are on over and triple time when it comes to cleaning, making sure that they are following the best standards when it comes to disinfecting. So when you go to the store, you have to practice good social distancing. It's pretty much pretending you have it and everyone else has it, which means that you don't want to be around someone where you might give it to them, and you don't want to be around someone who might give it to you as well. So when you're in a supermarket, we do have a lot of people in one spot. People still have to buy groceries. While you're there, the best way to move forward is to ensure that you are keeping that 6 feet apart, that you are using the disinfectant wipes, and also really, and I don't have to tell Wichitans this, be courteous to people who are in a stressful situation, where people, crises like this bring out sometimes the worst of our the worst of our personalities. It's a highly tense situation, and some of us with more of a cool head, we got to be mindful of that and not to inflame that, because we are likely to be in that situation at least one point or another, and we want our neighbors to also try to show us kindness as well.
And our grocery stores are working, looking at different hours that the vulnerable population can come in separate from the general population.
And too, Adrienne, I did want to ask from a health perspective, how things changed at your office?
It has changed a lot. It's a very different pace. We instituted our incident command system about a month ago at this point, and we instituted that because we could already see that it was getting beyond our capacity when we're spending Saturday and Sunday trying to contact each other. And so the incident command system puts us at that time, all in the office, and it's a very specific way of communicating. We have an operations section, we have logistics, we have finance, we have planning. So we have engaged a lot of our staff. We have approximately 135 people at the health department, and we still are maintaining some of our services on a scaled back basis, such as family planning by appointment and some immunizations that are still important to get, and WIC services, doing a lot more of that online. So we are skeleton in regards to the amount of people that are actually providing services, and more just totally focused on COVID-19 and what we need to do to provide information to our doctors and our community, and just a lot of moving pieces.
All right, 316-491-5787. That's the number. You can call with any question that you might have. Let's go to Richard. You have a question. Welcome to the show, Richard.
Yeah. Thank you. Mayor, I know that you're new to the office and not fully experienced yet with all your powers, but I hope that you would look to the idea of a moratorium on evictions from homes and from businesses to try to stabilize things for the next few months. We certainly don't want people moving around in the middle of time when they're supposed to be locked down, and when they're in a period of economic crisis in which being able to make the payments would be a problem. I can understand charging people, a little extra premium for a delay in their payments as an incentive to pay what they can when they can. But I think we have to face the fact that realistically there's going to be an awful lot of people facing risk of eviction. And in Kansas, as I understand it, evictions can happen in as little as 3 days. Mm-hmm. And I've seen a number of businessmen and a number of landlords who want to continue acting right now as if nothing had changed. And I think an awful lot of the citizens of this community need some protection against those who aren't facing up to this war and their role in it.
So let me, that's actually a very good comment. And so really what my role is as the county takes on the policy side at the very front end of this. We just started talking about how we're going to respond to this. As well, the county commission took on the policy side. I took on the community networking side. So one of the things I did is, you're right, I don't have the authority to tell people they can't evict. However, the governor does. So I've been in touch with her chief of staff to say, what are we doing to help people during this time who are going to be furloughed, who are going to be laid off. And I'm proud to say that the governor has actually made it so during this time you can't be evicted. You can't have a foreclosure go forward on your home. On the city level, I worked with the manager and made it so we won't have sewer and water shut off. Right now, you should, if you're furloughed and you only have a little bit amount of money or laid off, that should go to food. That should go to keeping you and your family stable. It shouldn't come to us. Like, we will carry that moving forward. That was one of the very first things I did. Also, reaching out to our gas company and our electric companies. Evergy had came out and said that they are not going to shut off electricity during this time. Same thing with Kansas Gas. Right now, they are going to implement the same rules that they would if it was wintertime, if it was cold out.
And Mayor, let me jump in and ask you here, where else have we seen some of these kinds of issues crop up where, look, we've got senior citizens out there who have some questions. Well, you know what, let's just go to the next caller. Is Evelyn. Sorry, Evelyn, hi. Craig with Call the Mayor. Welcome to the show. What is your question?
My question is if there's something they're going to do for the seniors, like, a lot of us are on Social Security, and that's not enough. And so we have to go to the food bank for some food, and so now they've been closed.
Yeah.
So is there any way that we're going to get anything from the government, or do you know anything about what they're going to do about the food banks?
Well, and that's a good question. The food bank situation, I know we've had this discussion. Your thought? Let's start with that and then jump into his question, because I know a lot of people have asked about food banks as well.
So there's really during that time when I was reaching out to the governor, reaching out to our community to figure out if we can do a stop on shutoffs, I also called in the United Way and asked them if they would be our one-stop shop for nonprofit services, including food, particularly for our vulnerable populations, where we don't want people who are 60 and older. We don't want, and those who are even older than that, who are senior citizens. We don't want you guys being exposed if it's unnecessary, because this virus has a bigger effect on that population than on the younger population. So please, if you're someone who needs necessities, call 211, the United Way. They're our partner in this. And also, if you're someone who might have stocked up on toilet paper just a little too much because you really bought into some of this concern, and now you are regretting it and might want to give those supplies to someone who needs it, such as maybe some of our seniors who aren't getting out to the grocery store as much out of precaution, you can give that to the United Way as well by calling 211. They'll be more than happy to help you out with that. So 211 is going to kind of fill in the gap.
It will. All right, let's go ahead and show the unflushables, please. I know we have to say this because, it's a different time. There are some items with the city that they recommend you just don't flush right now. So there, get a look. Here you go. Paper towels, rags, or other items. This could create a small crisis. And I know you don't think about that, but the sewer systems, Public Works is saying, please remember only human waste. Toilet paper is flushable. Don't forget that. Flushable wipes, that can clog the system, and that could cause a major problem, and that just means calling in more people and wasting resources that really shouldn't be wasted at this time. So that's kind of a public plea there. I did want to put that out there. Thank you very much. 316-491-5787. Claude, you are on the show. Claude, what is your question today?
Good evening, Mayor.
Good evening, sir.
I've been a volunteer with the Safe Century 2 group, gathering signatures on the petition. It's impossible for that to continue right now due to the coronavirus scare. Would you consider recommending that we get an extension or be allowed an extension of the time to gather the signatures because of the virus?
So which camera am I at? Okay. So one of the things I have to do in my job is I think a lot of people know who the mayor is, and they come to me and ask me to do certain things. And part of my job is to educate and talk about the division of powers. I really think you would have to talk to the county election commission, I believe, would be the one to make the call on that, possibly the Secretary of State. As mayor, there's really not much I think I can do to extend that. My understanding is that falls more under statutory interpretation through our Sedgwick County commissioner over in the elections office, our elections commissioner. And please just know I thank you for not going out and continuing to collect these signatures. Some of the things that we might not think about when it comes to disinfecting is pens, stuff that are used by lots of other people, and some of the best practices is to not just stay away, but also bring your own pen, utilize your own pen, make sure you are disinfecting things like your cell phone, things like your keyboard, stuff like that. And so I'm very glad that you guys, over your petition, are doing a responsible thing and putting a stop to that. I know that can't be easy because I know the people who are so passionate about that petition drive, and you are really putting the community safety and health above, I think, a lot of those political, or not even political, but those issue motives.
So it might be something that we could look into for as far as extending that out. You said there would be possibility through the county to see if that could be pushed back as far as the deadlines go. Just to be clear,
pretty much,
to the heart of this question. Yeah.
Of course. So pretty much my answer is, my understanding is the mayor doesn't have that authority. So that, I believe, is either the authority of the Secretary of State or Tabitha over at the Election Commission. So we'd have to check there. If there is a possibility to extend it, then that would, they should. If it does fall to me, if I go to work tomorrow and someone says, hey, Mayor, it's your second month and you don't know everything yet, so you actually could extend this, I definitely would extend it, because I think it's an important part of democracy to allow petition drives to move forward. And again, I don't want to penalize someone for doing a responsible thing.
Right.
But I think that power falls outside of my office.
Okay. This next question could be for either one of you. I know, Adrienne, you're not a medical doctor per se, but you are the county health director. So 316-491, either of you, I think for this next question, 5787, 491-5787. Varen, I hope I'm getting your name right. Thanks for being on the show. What's your question?
Yeah, thank you. Good evening. My question is to the medical director. If we come to a point of a worst case scenario, when we run out of hospital beds, I know in China and Italy and other countries, they have backup plans of converting schools and other indoor facilities into emergency isolation facilities. Do we have such facilities or plans in place, and is our city working on arranging the supply chain for those activities?
The hospitals have their own incident command system, and they have plans in place as far as where they would go if their hospitals become overrun and their beds are full. They have plans in place as to where that location would be and how to get that set up.
Okay.
So I'll just talk.
Go ahead.
Sorry.
Never mind. I'm picking up my phone again, so I'm continuing to disinfect. That's okay.
Just make sure Craig's okay. All right. So some of the discussion, and this is very interesting because we're in a unique situation where we can't just throw cots into Century 2 unless you can actually, spread them out. So some of the discussions I've been having with leaders in Topeka have been possibly utilizing maybe dorm rooms or other types of facilities that actually are very similar to hospital rooms, because they have private bathrooms and they are separated. So some of that discussion is ongoing. Of course, when I hear it and I report it, I find out like the next day that that's changed because the city's not in a driver's seat. We're more of a supportive role. But from my understanding, they are looking at some of these other options that are in our community. However, let's hope it doesn't get to that. If we do our job, we can flatten the curve and make sure that we don't overrun our hospitals.
Adrienne, thoughts?
That is totally correct. That is the whole hope of people really taking this serious and maintaining the 6 foot distance. And a lot of what that is for is to keep a distance from someone that might be ill. And someone can sneeze or cough that forcefully, but ordinarily in a 6 foot distance, if someone doesn't sneeze or cough into their elbow or shoulder and just were to cough or sneeze out, that 6 feet would be a big enough, large enough distance where it wouldn't be it would be far enough away where someone wouldn't be breathing that in.
And Adrienne, I want to draw that distinction here. Normally we sit pretty close together, right on the, but we're maintaining some distance here. Again, we're not necessarily recommending that a group of more than I believe 10 right now gets together at the same time.
That's correct.
It's the sneezing and the coughing that we need to be very aware of?
We do, and really practicing what we're always talking about as far as being cognizant and either grabbing that tissue and sneezing or coughing into that, or the elbow and shoulder, and just washing our hands a lot. And my hope out of this horrible time that everyone in our country and world are being affected by, that we will get better about washing our hands and not touching our face, and that we will save more people from dying from the flu.
So, and let me just add to that about
Yes.
the 10 people. I got a conversation with a martial art instructor who was very upset that she had to close down her business, and she, how am I not essential?
Sure.
And it was more about 10 people in one space and the risk of transmitting disease. And after talking with this person, it's not that that your business isn't essential. It's how you do it. You can still go and meet 10 people in a park and have the safe social distancing and lead a martial art class or group yoga. We're seeing a lot of small businesses who are taking their stuff online. We're seeing people who are utilizing social media and some of the technology available to us to keep that social distance, but still progress with what they do. And I want to be very careful by saying that this stay-home order, it's really more of a stay-safe order. So you can go walk your dog, you can go and do this other stuff that is not going to get you in an unsafe distance with someone else. So the stay-home order, I've getting a lot of questions about this on my social media, and it is really, think of it more as a stay-safe order, where you go out, get what you need, your necessities, and then you come back. If you're someone who used to go out every other day to the supermarket to pick up stuff, we're going to ask you to grab 2 weeks worth of stuff. You can go to the park, you can do some of this normal stuff, as long as you keep that safe distance away from other people who might be carrying this type of virus, because it is droplets that we're worried about.
And Andrew, we'll get to your call here in a second, 316-491-5787. There's, for more information, sedgwickcounty.org/COVID-19. If you don't get the dash in there, I won't go to that. But Adrienne, one quick question for you. I do know that I'm fastidiously not touching door handles. If I do, I've got the alcohol spray that I literally spray on.
Yeah, so Craig has sprayed his hand about 5 times
I
already.
know,
So
he's
taking it serious.
But when I put my hands down on paper, I don't know what this paper's been. Am I being too paranoid here?
I think it's important to take the actions that you can take. And you really don't know where, we're still learning more all the time about how long the virus stays on certain surfaces, whether it's plastic, whether it's certain metals. So it could be 6 to 72 hours depending upon the surface, and you don't want to have to keep that list of, well, is this plastic or is this? So it's just good to know that if you touch surfaces, clean them and keep your hands. That's the biggest behavioral challenge that we all have, is to keep our hands away from our eyes, nose, and mouth. But that is a lot about what we need to do.
Okay, 316-491-5787. Andrew, thank you for being patient. Andrew, you're on the show. What is your question? We are here, Andrew, if you're there still.
Can you hear us, Andrew?
All right, we'll get back to you in a moment if you're still there. I didn't want to talk about 259. USD 259. There's meals for kids. We are continuing some of those things because a lot of the community partners have stepped up to say, we're going to do what we can. In my little hometown, my son is being offered meals, but kids can eat free. These are grab and go meals, by the way. It begins March 25, so we are now under that as of yesterday, kind of 11:30 to 12:30 there. That's Monday through Friday, by the way, but there you can get more information at 259.org, USD259.org. I also want to mention the ICTresponse.com. Now, this, I feel like a lot of people have wanted to talk about this. Mayor, I know you've wanted to talk about this. Support your local business. This is the web address. Information on supporting your local businesses during the outbreak can be found at ICTresponse.com. I understand this is not a 100% comprehensive list, but how important is it? I know we've talked about this. I know a lot of lawmakers, both state and federal, have talked about this. How important is it going to be to support our local businesses any way we can right now, whether it's drive-through, carry out? Honestly, I don't even know if delivery is happening right now. I don't know, but how important is this? I know you feel, Mayor, that this is a pretty big deal.
Yeah, let me talk about this website, a couple of things. Sure. First of all, During that time when we were getting all the players within our community to try to network, one of the things we wanted to do that I thought we should do is have a Christmas in March, where our businesses are really suffering, our small businesses. Let's go and create a one-stop place to list the websites of those businesses so that they can actually, we could buy gift certificates. We can go and do our Christmas shopping right now, utilizing our own online abilities. Now, a really interesting story here, and it shows how leadership in these type of situations doesn't come from the top down. It comes from the bottom up. And Wichita really has the best people in the entire world, because while I was having this idea and floating it around to people, I found out that someone beat me to the punch. That there was a woman who, I think she's a sophomore, college age woman, who was laid off or had to close down her business during this, and she wanted to make sure that she utilized this time for the good of the community. And her team, her name's Kenzie, actually started building this website. So I called her, I reached out to her, and I said, hey, I hear you're doing this. Do you need anything? Can I put you in touch with any of the business leadership, or what else can we do? She actually expanded this website, her and her team, completely free, bottom up. This is a community service, to not just have links to help the small businesses, but also to have information about this virus, and also have some of these they have information about childcare. It's a one-stop shop. It's an extensive website. I checked in on her a few days ago and asked her, how's it going? She said that small businesses are reporting, their web information, so that she's still updating it. And it's just, and I asked her if she needed anything, let's start a GoFundMe page to help you through this. And she said, it's all my time. I have to stay home because of, I think she has a medical issue where she has to actually stay home this whole time. So she's just working on this. She said, I'm $11 into it. Which kind of shows you the value of our community. When you go to ICT Response and you see that page and you see the amazing work that's there, just know that is completely community driven, that is organic, and it's because we have some of the best people in the world living right here in Wichita.
Cannot argue with that sentiment. I am big on Wichita. Okay, 316-491-5787. That's the number. Call the Mayor of Wichita. Again, thanks for Mayor Whipple for being here. Adrienne Byrne, County Health Director, thank you for being here. Appreciate it. Let's go to Jennifer, if you're still there. Jennifer, if you're there, welcome.
No.
And what is your question?
I'm getting the,
oh boy.
She hung up on a signal.
Well, let's see if we can get Jennifer back if she's still out there.
Call back, Jennifer. I won't talk so much this time.
Now, I know that there are groups that continue to reach out to say, hey, it's business as usual for us, or we have to be business as usual. Mm-hmm. The Red Cross, donate blood. We do have a quote from the Surgeon General, and I'd like to share that with you right now. We do still need to keep the wheels turning, especially with our healthcare workers and our healthcare needs. Those are going to be out there. The Red Cross is still saying at this point, you can still go out and give blood. Social distancing does not mean, does not have to mean social disengagement. And I think that's a very telling quote from our U.S. Surgeon General. It does not mean social disengagement. So they are asking you to still give blood. We still need that on a timely basis, because when it has to be there, it has to be there. And Adrienne, I had another branch off question for you. When it comes to the response, and I don't want to put you on the spot here, but how have we been doing? I know everybody's saying World War II, or perhaps beyond that, when we've had something quite like this, or had to deal with something, kind of making up some of the things as we go. I know our health professionals are doing what they can. People are making masks, but have we seen something like this in kind of this lifespan?
No.
Straight up, no.
No. I mean, we had the H1N1 outbreak in 2009, but there's never been anything like this in regards to how quickly it changes. And it is a challenge to stay on top of the information, because it is coming in so quickly. And since it's only been in the United States for 2 months. And here we are already at the numbers we are, which is frightening, over 82,000 cases in the 2 months that it's been here. So this is brand new, and there's a lot still that there is to learn about it.
Okay, and again, we don't want to scare people, but we do want to bring up the reality. This is different than the normal seasonal flu, and a lot of people get sick from the normal seasonal flu, and a lot of people do die from the flu.
Yes, they do.
Again, that's our vulnerable people with some health issues. That's our senior population. These people are a little bit more at risk for some of these things hitting them harder than others. So this is why we're doing this. Okay, we do have another caller, 316-491-5787. Go ahead, you're on the show. You had a question about cleaning, disinfecting.
Okay, for our mayor and for Craig and the county, the CDC, it's the Center for Disease Control, has recommended that we have 4 teaspoons of Clorox bleach in a quart bottle of water as a way to spray down the handle of our doors when we come in, the driver's steering wheel when we get out of our car, and of course wash our hands when we come in. So we protect our families right from the start. This is a very good disinfectant, as opposed to just saying, well, they're out of wipes, so I can't do anything for my family. So the question is the county and the city going to put that kind of information on your website so we can make sure that folks can protect themselves?
You know, we should, and I can at least put it on my own personal outreach, and I'll talk to our communication person tomorrow, because I had someone on my social media post, and it's been very active, where that's the way that we're able to answer questions about this. And someone posted, "Hey, we're out of wipes, what do I do?" And it was, we can make homemade disinfectant. We can utilize rubbing alcohol. We can utilize some of these other types of these types of products that we have at home, or that might not be sold out, even if the disinfectant wipes are sold out. And I believe there's actually some pretty effective homemade hand sanitizer out there as well. So there's a lot of options out there. Luckily, we have the internet. I think it would be a pretty brief Google search to find some of these recipes, and it is something that we should probably put out there on our website to ensure that people have that information when they look at ours.
And
we do have that information.
Okay.
They'll go to Sedgwick County and click on the COVID-19. We have all the links to the Center for Disease Control, and that contain the information about what products to use.
Okay, and there you go.
We'll definitely
Sedgwick
get on our
County.
website then if they got on there. So
sedgwickcounty.org/COVID-19. Walt, thank you for that. I appreciate it. Some good advice. And again, make sure you're using things that have some proven efficacy. I mean, I think that's probably the correct thing to say here, is make sure there's some science to it. Call the Mayor of Wichita, 316-491-5787. Sandy, you are on the show. What is your question for the mayor?
My question is, you get sick and you have a lot of problems, lung problems. What is it that they do in the hospital that you can't do at home?
So I'm gonna pass this over to the medical professional here, but I believe that it's more than just like riding out the storm.
Well, and most people are not going to need to be hospitalized. Over 80% of people that do contract COVID-19 are going to have very mild symptoms. And so people that are hospitalized are going to need more care than just being able to stay at home, but they're really mainly treating the symptoms. And then if someone develops a secondary condition such as pneumonia, then they're going to treat the pneumonia, but the majority of the people are going to be able to stay home and just really focus more on the symptoms.
Well, I appreciate your expertise. I know you're not a medical doctor per se, but I appreciate your expertise on this because you are our county health director. And again, some of those common sense things about, don't overload the 911 system. I know that the county talked about this week. Please don't overload the 911 system. You can call 211 here in the county. You can call 316-660-9000. That's 316-660-9000. That will answer some of your questions about, do I need to see a doctor right away? And again, some of those emergency things, if you're having a genuine emergency, if you're having trouble breathing, you're having some of that tightness in your chest, some of these typical symptoms that we see, clearly if you're in complete distress, go ahead and call 911. But we do have some resources out there. So 211 in Sedgwick County, 316-660-9000 is the number. So Jack, you are on Call the Mayor. What is your question? Welcome to the show, Jack. Jack, if you're there, welcome to the show.
Jack, I heard a beep. Did we?
Yeah, I'm here.
Hey, Jack.
Okay, I'm a senior citizen. I'm 85 years old. I've grown up in this community, and every season I have flu shots because the flu doesn't just come back. The experts tell us, once we flatten the curve, we can expect it to be back the next season and then the next year. My question is, would you consider putting together a committee right now to start preparing for those kind of shortages that we're going to see not only this time, but next time and the time after that? I won't be here to worry about it, but I wanted to be there for my grandkids.
Jack, you might be. Thank you for the call. I'm going to let both of you answer this because I think there's some really good takeaways here.
So, a couple things, and of course, my doctorate's useless. So I'm gonna, if I say anything that is not correct, please correct me on it. My understanding is that this virus is new to people. It's something that our immune system isn't actually geared up to really combat. But once we do, then we get the antibodies to it. So he's right that once it's kind of in our community, it might come back again, but we'll be better prepared for it. Right now, by flattening the curve, the first time you get it is going to be probably the worst time. So we want to make sure that if you do have a really bad response, you can get to the hospital and get that checked out and then get back out here. But if you get it again, then it's likely that your body will be able to fight it off by then, just like with other types of viruses. As far as being forward thinking with this, yeah, of course. I think that this is something that is completely unprecedented. It's something that, as was confirmed by the medical professional here, that it is something that we've never seen before. And we do have to be prepared for this in the future and do a better job of being prepared for it. However, it really kind of came out of, just no one, I think, in the beginning of the year thought that we would be going through a pandemic in March, right? So it's one of those where you want a scenario plan, you want to be prepared, but this is something that caught us off guard. In the future, I think that we will be better prepared for this type of situation. In the future, I think our bodies will be able to combat this particular virus better, and hopefully we're going to have some breakthroughs when it comes to treatment for this.
And there's some speculation because, again, it's only been in the United States for a little bit over 2 months, and in the world a month or two longer than that. At first it was thought that this really wasn't seasonal at all, and now there's thoughts that there's going to be a second or a third wave. And I agree with Mayor Whipple that the community is going to be more prepared for it as time goes on, because we're going to continue to learn a whole lot about it. The National Institute of Health and others are working on a vaccination. It is said that it could be 12 to 18 months, but just like the H1N1 when it was new in 2009, now that's part of our community every year, but that's part of the vaccine, and we also have developed some of the immunity to it, and so it doesn't affect us in the way it did at that time.
Okay, Vivian, you're on the show. Go ahead. We've got like 30 seconds left. Vivian, welcome.
Okay, for the mayor and possibly the health director, I was reading on KSN on the computer that there's a doctor in Ohio that was saying that there is a new symptom that could be possibly gastrointestinal. Have you heard of any of that?
No.
No.
The main symptoms continue to be a cough, a fever over 100.4, and shortness of breath.
Very good.
And
okay.
It's it's very important to make sure that we look up the symptoms and know it. I think it's very easy to say, oh, I feel sick and now I'm worried I have this. And those are puts us in trouble if that person who doesn't have this but has symptoms of something else utilizes the healthcare facility when they could have just stayed home.
And again, I know a lot of people have questions, so let's go ahead and talk about that again. 316-660-9000. Now, to break this out, the 660-9000, that is for questions about the stay-at-home order. I know a lot of people have questions about that. But I may have misspoke a little bit. Let's just break these out to be clear. The 211 number is for the nurse triage line.
Yes, if someone is concerned that they may have come into contact with someone that has COVID-19 or believe that they may have that, they call 211.
Okay.
And then they will ask them questions. If they believe that they are at high risk for that, then they will connect them with one of our nurses.
Thank you very much. Mayor, thank you as well.
Thanks for having me.
Appreciate it. That is Call the Mayor of Wichita. We'll see you again next time.